So hello students, today topic of discussion is the pendulum appliance. So first of all, you have to remember is who first of all discovered this appliance. So remember James J. Hilger of California. So remember for your exam, who first of all discovered this appliance? Well, it was James J. Hilger of California, who first of all introduced the pendulum appliance. So next we have to know is what is the pendulum appliance? What is it used for? That is the first question that usually comes to your mind. So well, it uses, what it does is it uses force to distalize the upper first molar to create space for eruption of third molar for correction of the class 2 malocclusion. So what you see is it is an excellent technique. It is an excellent technique to correct class 2 malocclusion without resort to extraction. So remember, this distalization is more efficient before the upper second molar have erupted. Now, where can we use this appliance? Think, when there is forward positioning of one molar due to the early loss of the deciduous teeth, or when there is mesial drifting of the teeth, that is the root cause of the malocclusion. So do you know, even we can use pendulum springs on one side that can regain space without putting any strain on the other part of the upper arch. So what will you see? As we know that the pendulum appliance, what will it do? It will cause distalization of the molar. Along with that, what will you see is that the distalization will cause downward and backward. It will cause downward and backward mandibular rotation. That occurs in the clockwise direction. So what will it cause? It will increase the anterior facial height, particularly the lower third. Also, it will increase the facial convexity angle. So there will be increase in the mandibular plane angle with respect to the base of the skull. So there is increase in the lower anterior facial height due to the clockwise mandibular rotation. Now, can we use this appliance in class 1 and class 3 malocclusion? No, it is used to correct class 2 malocclusion. So well, that is correct. If there is excessive lower facial height, can we use it? No, we can't use it, as it increases the lower facial height. So suppose in patient, when there is a short lower face height, yes, this is the situation where we use the pendulum appliance. That is what you have to remember for your exam. Can we use the pendulum appliance in class 2 skeleton base? No, it is not used. It is used in class 2 or end-on and molar relation cases. Can we use it in skeleton open bite or dental open bite? No, because it will sometimes cause anterior open bite. Now let us discuss the components of the pendulum appliance. What are the components of this appliance? Number one, it consists of Nance acrylic button, TMA spring, along with wire component that includes closed helix, small horizontal loop, and the wires, small horizontal loops, and the wire connecting on band to the first molar and the second premolar. So what we have is small horizontal adjustment, a closed helix, a loop for retention in the acrylic button. Now, what is this? What is the use of this Nance anchorage? So it has a large Nance acrylic button in the pallet. Its purpose is for anchorage. What is the use of TMA spring? Well, that spring will deliver light continuous force to the pallet. Aspect of maxillary first molar. So what would this appliance do? So what you will see is the appliance, it will produce a swinging arch or pendulum of force from the midline of palate to the upper molars. So this distalization is produced by opening the helix, forcefully engaging the distal ends into the sleeve. So what you will see is, so once the appliance is in mouth, the springs are inserted into the lingual sheath of the molar bands to allow forces to be distally. So there is a readjustment of springs, remember, every 3 weeks. So as the molar moves distally, the forces of springs that will cause molar to move in arch toward the midline of the palate. So that could lead to the, remember, that could lead to the cross bite in the posterior teeth. So in order to avoid this side effect, what we do is we make adjustment loops to counteract this medial movement of the first molar. Other thing that you have to remember is the upper molar. They are utilized into the to place a transpalatal arch or Nance appliance immediately after the removal of pendulum appliance. So let us discuss now some important things, some important values that can be asked in your NEET exam. First thing that you have to remember is the pre-activation of appliance. The mandates bending of the TMA spring 90° or parallel to the midline of the palate. Second, the initial activation that will that will generate a force of 250 gram of force per side. And digitalization arm or spring, they are constructed from zero point 0.6 mm stainless steel round wire that is consist of closed helix and U-loop. So that is the important values that you have to remember for your exam. And the TM springs that we use is of 0.0232 inches. So another important value for your NEET MCQ point of view. So these are the important points regarding the pendulum appliance that you all guys have to remember. It is a very important topic that has been asked again and again in either NEET or AIMS entrance exam. So if you know this topic well, you can give a better score in the exam if the questions are asked related to this topic. So this was all about the pendulum appliance.